SMA is a spectrum disease, so you do have patients who have the most severe forms of neuromuscular weakness, and you have patients who are mildly symptomatic. What we need to be doing is, the patients who are the most severely affected are very obviously affected in a way that's going to compromise their respiratory function. Patients who are a little bit milder, it may not actually be as obvious. And so we need to be able to use the tools that allow us to screen for any type of respiratory insufficiency. Now, I think everyone is quite aware of obstructive sleep apnea, and patients with neuromuscular disease, including SMA, are at risk for obstructive sleep apnea. But what perhaps is not as well appreciated is the fact that there's compromised diaphragmatic function, and we have to screen for that. That leads to hypoventilation, and we have specific tests that can screen for that, such as looking for hypercarbia by testing carbon dioxide and tidal carbon dioxide. The other thing that we have to be aware of is the patient's ability to clear their airways. Now, people who have normal neuromuscular function can cough quite well, and they clear their airways very well. But patients who have neuromuscular disease, they need assistance with airways clearance. And so if you have perhaps not the most severe respiratory compromise, you may have an insufficient cough. And so we have cough assist devices or insufflator, exsufflator type devices that can help to clear the airways. So 3 different things. We're talking about upper airway, obstructive sleep apnea, we're talking about diaphragmatic function, and then we're talking about expiratory muscles as they play a role in airways clearance. So there was a poster that reported on the response of type 1 SMA patients, 9 type 1 SMA patients after treatment with nusinersen. And they did show some benefit with improved scales such as CHOP and 10 and CMAP scores. However, what they did find was that all of the patients had swallowing dysfunction and respiratory dysfunction, and that this did not resolve with nusinersen treatment. This is, of course, an interesting finding, an important finding, because I think it illustrates that there are some motor, neuromuscular function, there are some motor skills which can be irreversibly lost in the course of the disease. And if that's not surprising to some extent, because we do know that this is a progressive disease that can lead to irreversible motor neuron death. So what we would expect is that the patient's function, which relates to motor neurons which have not completely degenerated, are more likely to respond to treatments such as nusinersen, which restore SMN protein expression.